Good morning, good afternoon, and good evening, everyone. Welcome to today's webinar. I'm sure we're joining from all across the globe, and we're excited that you decided to spend this time with us today. My name is Francine Wood, and I am a postdoctoral scholar with the University of California, San Diego's Center on Gender Equity and Health. Today, we'll be exploring data from 3 continents, 5 interventions, and 50,000 adolescents to advance research and practice. As you can see on the slide, we will start by setting the stage with a brief introduction on why VYA investments are important and provide an overview of the Global Early Adolescent Study. Next, we will hear from our 3 panelists, followed by a review of the theory of change, and hear from reflections from a youth member of the Global Early Adolescent Study, and end with a Q&A discussion. So just to go over a few housekeeping. Participants are muted throughout the duration of the conversation, but if you have any questions, please type them in the chat box as we move along. We'll be moderating the chat box and we'll get back to the questions as time allows during the Q&A period. The conversation will last approximately an hour and a half and will be simultaneously translated into French. If you haven't selected a language already, please click the globe icon at the bottom of the Zoom screen and select either English or French interpretation. It's also being recorded, and the recordings will be available in the coming days. If you have any technical issues with the language, please message myself or Trevor. Now I'm pleased to introduce our moderators and speakers for today. To moderate our session, we have the pleasure of joining us today, Dr. Kristen Imari. She is a Bloomberg Association Professor of Adolescent Health at Johns Hopkins and co-leads the Global Early Adolescent Study. Our second moderator is Dr. Rebecca Lundgren. She is an applied anthropologist and professor at University of California, San Diego. Next, our speakers. Our first speaker is Grandi Mbadu. He is a Global Youth Advisory Board member of the Global Early Adolescent Study and is currently serving as Executive Secretary of the Growing Up Great Youth Council. Our next speaker is Blandine Avaledi. She has been in the humanitarian field for over 10 years and currently works as a sexual and reproductive health manager at Save the Children International in the DRC. From Indonesia, we have Amala Rama. She is a country representative at Rutgers, Indonesia, and leads 5 large consortia that implement sexual and reproductive health rights programs. Finally, our last speaker is Dr. Karen Austrian. She is a globally recognized expert in adolescent health who leads the Population Council's Girl Innovation Research and Learning Center. So I would now hand it off to our first moderator, Dr. Rebecca Lundgren. Over to you, Rebecca.
Thank you, Francine. Hi, everyone. Good morning, good afternoon. On behalf of the Intervention Working Group of the Global Early Adolescent Study, I'm very pleased to welcome you to this webinar. As many of you know, the GEAS is a multinational longitudinal study exploring gender norms and their implications for adolescent health and well-being. The goals of the study are 2. First, to understand how gender informs health and well-being across adolescence and how this process unfolds in very different contexts. We're also looking at testing how gender and transformative interventions in early adolescence contribute to improving adolescent health and well-being. There's a long and robust history and practice of working with adolescents. So I'd like to talk just for a couple minutes about why we're particularly interested in very young adolescents. And you can click through this, yes. Here on this slide, you can see in statistics why girls and boys between 10 and 14 matter to global health and development. They represent a large and growing population, and most reside in low and middle income countries. So early adolescence provides a window of opportunity to foster positive and development trajectories across an array of areas spanning cognitive development, education, to sexual and reproductive health. It's a time of very rapid physical and social development with brain development second only to the first 1,000 days of life. In fact, improving VYA outcomes contributes to multiple SDGs. It's during this young period of life, especially, that norms which define and dictate appropriate behaviors are established. Gender norms have profound implications for health and well-being, informing both risk and protective behaviors across multiple domains. The influence of gender norms is particularly salient in this early adolescent phase, as health disparities between boys and girls emerge at this point. Early adolescence is viewed sometimes as a bridge from puberty to healthy sexual and reproductive health behaviors. This is an opportunity for boys and girls to acquire internal assets such as body literacy, self-efficacy, gender equitable attitudes that will facilitate their healthy transition through puberty. The presence or absence of structural, family, and community assets can support or hinder them on their journey to adulthood. Access to youth-friendly services, quality education, and economic opportunities, combined with safe, supportive communities and families, position young people for success. Next slide, please. There's growing interest in early adolescent programs. A 2010 landscape found only 18 curriculum-based studies with strategies to reach young adolescents to improve SRH outcomes. However, the evidence over the last decade has grown substantially. You can see here a list of some of the different interventions for young people, and a recent landscape conducted by Callie Simon at Save the Children found 60 programs and 6 cross-country research initiatives. In some of the countries where the Global Early Adolescent Study took place, interventions were also conducted, and the longitudinal research was used to assess program effects. This intervention working group brought together 5 early adolescent programs to critically examine mechanisms of change and program assumptions. By exploring what we have in common and how we're different from each other, examining our program data, and sharing our challenges, we developed a common theory of change and identified conditions of success. You'll hear more about our theory of change from Kristen Mari in a little bit. First, though, we're going to hear from 3 of these programs with speakers from the DRC, Kenya, and Indonesia. To start us off, I'd like to introduce Blandine Avaleti from Save the Children in the Democratic Republic of Congo. Blandine will be speaking in French, so be sure to have your interpretation enabled if you would like French interpretation. Over to you, Blandine.
Bonjour à tous. Je réponds au nom de Blandine, comme on l'a dit tout à l'heure. Je travaille avec Save the Children. Je suis basée à Kinshasa, la ville-province de la RDC. Donc, nous allons vous parler de notre intervention Bien Grandir, qui était une intervention, je dis était parce qu'elle est pratiquement arrivée à la fin. C'était une intervention sur le changement des normes sociales en faveur de la santé sexuelle et reproductive des très jeunes adolescents. C'est quoi que nous appelons ce programme Bien Grandir? Le slide suivant, s'il vous plaît. Donc, c'est quoi Bien Grandir? Bien Grandir, c'est un projet qui a été mis en œuvre dans la ville-province de Kinshasa, comme je l'ai dit tout à l'heure, mais c'était plutôt une expérience des autres programmes qui ont été mis en œuvre par Save the Children, notamment le programme Great, Choice, Voice et Promises, par rapport à ces différentes expériences, aux différents outils qui ont été utilisés dans ces différents programmes. Nous les avons contextualisés par rapport à notre pays, par rapport à notre ville de Kinshasa, et nous avons eu à développer des outils pour pouvoir impliquer les très jeunes adolescents et aussi les différentes personnes qui jouent un rôle dans le développement des attitudes et des comportements auprès de ces très jeunes adolescents. Le programme Bien Grandir aborde les normes de genre, la violence liée sur le sexe, mais de façon un peu ludique, parce que nous avons à utiliser les différents outils qui reprenaient plusieurs thématiques sur la santé sexuelle, sur le genre, sur comment bien grandir, sur la puberté. D'autres activités étaient comme des jeux attrayantes, mais au travers desquels nous avions un message particulier par rapport à la santé sexuelle et reproductive pour ces très jeunes adolescents et les différentes personnes que nous avons ciblées qui jouaient un rôle dans le développement des attitudes et des comportements de ces très jeunes adolescents. Il a été mis en œuvre à Kinshasa dans 3 communes périurbaines de cette ville. Le stade suivant. Comment est-ce que nous avons mis en œuvre ces programmes Bien Grandir? Nous avons utilisé ces modèles socio-écologiques que vous voyez sur l'écran. Notre cible principale, c'était les très jeunes adolescents, mais nous avons travaillé aussi avec les parents de ces très jeunes adolescents. Nous avons travaillé avec les enseignants qui encadrent ces très jeunes adolescents au niveau des écoles. Nous avons travaillé aussi avec les prestataires de soins parce qu'ils auront aussi besoin à un moment ou un autre de pouvoir utiliser le service au niveau d'une structure de santé. Et nous avons aussi travaillé avec d'autres membres de la communauté. Avec ces très jeunes adolescents, nous avons mené des activités au niveau des écoles et aussi au niveau communautaire. Nous avons réuni ces très jeunes adolescents dans des clubs qui étaient mixtes au niveau des écoles et nous avons aussi ciblé quelques très jeunes adolescents au niveau communautaire. Et nous avons développé ces différents outils. Le cadre que vous voyez là sur les images, il y avait des livres sur la puberté pour les filles et aussi pour les garçons, des boîtes à images pour les filles et pour les garçons, des cartes d'activité, et un autre jeu aussi qui ressemblait un peu à un jeu de 6 avec des dés et aussi des différentes questions sur la santé sexuelle et reproductive que les adolescents jouaient pendant leur session de club et ces clubs étaient animés par eux-mêmes, les très jeunes adolescents, donc des pairs qu'on a formés pour pouvoir faciliter les sessions sous l'encadrement, bien sûr, des enseignants, points focaux que nous avons eu aussi à former sur l'utilisation de ces différents outils au niveau des écoles. Au niveau de la famille, qu'est-ce que nous avons fait? Nous sommes dit, pour pouvoir mieux encadrer ces très jeunes adolescents, nous devons aussi travailler avec leurs parents, leur donner aussi des informations par rapport à la santé sexuelle et reproductive. Tout cela pour pouvoir créer des cadres de discussion, que les très jeunes adolescents aient l'information et que les parents aussi aient l'information pour qu'ils puissent avoir un très bon dialogue et une très bonne discussion au niveau de la maison. Et pour les parents, on a eu à développer certaines vidéos avec des parents membres de la communauté qui ont eu à développer certaines normes positives par rapport à certaines normes qui influencent sur les attitudes et les services pour la santé sexuelle et reproductive des adolescents. Et ces parents-là se retrouvent au niveau de la communauté pour les clubs, pour les parents des enfants non scolarisés et au niveau des écoles pour les parents des enfants scolarisés. Au niveau scolaire, qu'est-ce que nous avons fait? Nous avons accompagné le ministère de l'EPST de l'éducation primaire et secondaire à pouvoir vulgariser un curriculum qui a été développé sur le programme national d'éducation à la vie familiale pour pouvoir être dispensé au niveau des écoles. Et nous avons mis à la disposition des ministères de l'Éducation nos différents outils qui ont été utilisés comme étant des matériels didactiques pour pouvoir illustrer ces différentes leçons contenues dans le curriculum des écoles. Et on a formé ces enseignants-là à utiliser le curriculum et aussi à bien sûr coupler avec les différents outils pour pouvoir illustrer leurs leçons. Au niveau des formations sanitaires, nous avons eu à former les prestataires de soins pour pouvoir offrir des services conviviaux adaptés aux besoins des très jeunes adolescents. Nous les avons formés au niveau de leur structure et nous leur avons aussi donné des outils, plutôt des contraceptifs pour pouvoir offrir le service. Et nous ne sommes pas arrêtés là. Nous avons aussi à organiser pour pouvoir créer des liens entre ces prestataires de soins et les adolescents qui se retrouvent au niveau des écoles et aussi au niveau communautaire. Nous avons à organiser des visites d'échange. Une fois par mois, le prestataire quittait sa formation sanitaire et se rendait au niveau de l'école où la session se déroulait et animait une leçon de prestataire. Et aussi, une fois le mois, les adolescents quittaient leur structure ou leur club au niveau communautaire et se rendaient au niveau de la formation sanitaire pour découvrir les différents services qui étaient disponibles pour leurs besoins en santé sexuelle et reproductive. Au niveau communautaire, nous avons réussi à travailler avec les membres de la communauté, avec les leaders communautaires aussi. Et là, nous avons eu aussi à utiliser les différentes vidéos que nous avons utilisées lors des sessions avec le parent, que ce soit au niveau communautaire et aussi au niveau des écoles. Le nombre de personnes que nous avons pu atteindre par rapport au programme depuis sa mise en œuvre jusqu'à aujourd'hui, c'est que nous avons eu à travailler avec 28 249 élèves au niveau des écoles. Nous avons eu à travailler aussi avec 657 enfants au niveau communautaire. Nous avons pu atteindre 2038 parents pendant les sessions des parents et nous avons travaillé avec 98 écoles. Et nous avons collaboré avec 70 prestataires de santé et le nombre de membres d'autres membres de la communauté que nous avons pu atteindre pendant ces différentes sessions vidéo s'élève à 2267. Slide suivant. Quels ont été les résultats après la mise en œuvre de ce programme bien grandi dans nos différentes zones d'intervention? C'est qu'avec GEAS, nous avons conduit une étude sur les très jeunes adolescents qui a exploré des changements dans ces 4 domaines qui vous sont présentés là. Dans le domaine des connaissances sur la santé sexuelle et reproductive, dans le domaine de l'agence et des atouts, dans le domaine des attitudes et normes en matière d'égalité des sexes et aussi dans le domaine des comportements équitables entre les sexes. Quel a été le résultat? Bien suivant. Par rapport à ces 4 domaines d'intervention, nous avons remarqué qu'il y a eu une amélioration des connaissances, que ce soit sur la santé sexuelle et reproductive, il y a eu une meilleure connaissance de la grossesse et du VIH, ainsi que de l'endroit où se procurer des préservatifs et des moyens de contraception. Ça, c'est vraiment pour les très jeunes adolescents, cela a été noté après cette évaluation. Il y a eu une amélioration des relations positives avec les soignants et la communication sur le sujet de santé sexuelle et reproductive. Les prestataires qui y a été une barrière pour l'accès aux services, ils ont développé de bonnes relations, de bonnes attitudes, de bonnes collaborations avec ces très jeunes adolescents. Il y a eu une augmentation des attitudes équitables entre les sexes concernant les activités sexuelles spécifiques. Partage des corvées, des tâches ménagères qui étaient beaucoup plus réservées seulement aux adolescentes, mais il y a eu un changement au niveau de la communauté et un changement qui a été observé, que ce soit au niveau des adolescents et même aussi au niveau des parents eux-mêmes. Et enfin, il y a eu une augmentation aussi des partages équitables de corvées entre les sexes et une diminution des taquineries et des brimades entre les pères eux-mêmes. Dia suivant. En plus de cette évaluation qui a été menée par GEAS, il y a eu aussi une autre évaluation que nous avons appelée une évaluation participative des jeunes. Parce que nous nous sommes dit, c'est vrai que nous avons travaillé pour les très jeunes adolescents pour pouvoir les aider à acquérir des compétences et des attitudes pour pouvoir utiliser le service de planification familiale. Mais nous avons aussi voulu les intégrer dans la mise en œuvre, le suivi, et aussi nous les avons aussi associés dans les évaluations des activités du projet. Parce que là, nous voyons un peu la pérennisation. On n'a pas voulu laisser ces adolescents-là parce qu'il y en avait ceux avec qui on a commencé, qui avaient l'âge de 10 ans, et après, autant d'années de mise en œuvre, ils sont devenus de très jeunes adolescents et nous les avons associés pour pouvoir mener ces différentes évaluations avec nous pour pouvoir assurer aussi la pérennisation, bien sûr, la durabilité après bien grandir. Et cette évaluation a montré aussi beaucoup de changements qui sont pratiquement similaires avec les différents changements que nous avons notés avec l'étude des GEAS. Diapositive suivante. Quelle a été la suite par rapport à ces temps de mise en œuvre de projets dans nos différentes zones d'intervention? Diapositive suivante. Nous avons pensé à la mise à échelle et à l'institutionnalisation parce que les projets, comme nous le savons, ont toujours une durée bien déterminée. Mais nous avons voulu que les acquis soient pérennes au niveau de la communauté. C'est ainsi que nous avons mis en place un cadre de maîtres formateurs formés au sein des principaux ministères avec lesquels nous avons travaillé, aussi avec les différents ONG, parce que c'était les ONG qui étaient beaucoup plus les acteurs de mise en œuvre et nous faisons beaucoup plus de suivi. Nous avons aussi mis en place les kits d'outils des très jeunes adolescents qui est vraiment intégré avec l'utilisation du programme national d'éducation à la vie familiale au niveau des écoles. Nous avons aussi formé les relais communautaires membres de la communauté pour pouvoir animer les sessions au niveau de la communauté. Et nous avons laissé aussi un cadre de collaboration permanente avec le ministère de la Santé et le ministère de l'Éducation pour pouvoir faire aussi le suivi par rapport aux activités VG+, que nous avons eu à intégrer au niveau de la communauté. Pour la diapositive il y a un bruit de fond. Voilà. Pour soutenir maintenant l'expansion, qu'est-ce que nous avons fait? Nous avons développé des guides d'adaptation, nous avons développé des guides de mise en œuvre et aussi des boîtes à outils pour les très jeunes adolescents. Et vous pouvez voir ces différents outils dans notre lien de ressources de Save the Children si vous êtes aussi intéressé. Voilà donc ce que nous avons eu à partager avec vous par rapport à cette initiative qui a été mise en œuvre ici en RDC. Nous vous disons merci.
Hi, everyone. My name is Karen Austrian. I am a senior researcher at Population Council who leads our work on adolescence, which is one of the 4 strategic priorities of and research goals for Population Council. I'm based in Nairobi, Kenya, and I will be sharing some about a program and a research study that we did called NISITU, which stands for Nisikilize Tujengane, which means listen to me and let's grow together. This was a study that was implemented a couple of years ago, and as it very much focused on gender norms, we have been close partners and in line with the Global Early Adolescent Study, and are happy to be sharing these results today. So this work comes sort of our team, both at the council globally and the Population Council Kenyan team had been spending, at least 10 to 15 years studying various interventions, evaluating the impact of different packages of programs for adolescent girls. But we were always getting the question, what about the boys? Which is a very valid question. And important to ask when we're thinking about programming and the effects of programming for very young adolescents. But sometimes, that question came from a place of, well, if girls are getting a program, then boys should be too, and sort of this knee-jerk reaction that it wouldn't be fair if girls were getting something, which is frankly a question that we had a little bit less patience for, and understanding that there are quite a lot of things that boys just naturally get in their communities that girls don't have access to by virtue of being girls. However, that question often comes also from a place of saying, well, wouldn't it make more sense if you were working with both girls and boys, and with boys and with men in a community, not only to improve the lives of boys and men, but also to improve girls' lives? And this recognition that girls and boys live together, they are classmates, they are neighbors, they are friends, they are relatives, they are future partners, and that it really takes working together to change attitudes, norms, experience of violence. And so what we did was we started the NISITU program, the core intervention to try to really sort of design an intervention that would address and set up in a systematic experiment to answer that question. So what does it mean that, are girls better off when boys are also included in general programming for very young adolescents? So the intervention itself was largely made up of weekly safe spaces groups. So these were groups they met over the course of about a year for 1.5 hours each week. These groups were facilitated by a mentor of the same sex. So the girls groups were facilitated by young women, about, I would say, sort of 20 to 30 years old. So young enough to be relatable, but also older that they could serve as mentors. They could serve as sort of somebody that the girls and the boys could see themselves becoming in the not too distant future. And then the groups themselves, as I mentioned, were segmented by sex. So there were girls groups and there were boys groups, and there were also segmented by age. So while the program worked with 10 to 19-year-olds, the 10 to 14-year-olds met separately, and the 15 to 19-year-olds met separately. Both, learning styles are different, lived experiences are different, and the dynamics within the group were different. And so we felt that more homogeneous age would be appropriate. The session content included a range of activities. So there were sessions on sexual and reproductive health and life skills, financial education, heavy content on gender norms. So we adapted the EMAP curriculum, which had been developed by the International Rescue Committee, that was more designed to explore sort of gender norms and power within married couples. So we did an adaptation for adolescents. And then in our older adolescent groups, we also had content on entrepreneurship, starting a business, etc. So just to give you a sense, as I mentioned, these groups met once a week. After the first couple of months, once the groups were settled, also in addition, once a month, there were sort of each girls group and boys group were paired up, and they would meet once a month together to also sort of stimulate discussion together and modeling, ideally, of sort of the healthy conversation and debate amongst girls and boys. Just to give you a sense of the context, so this took place in 2 urban informal settlements in Kenya, one in Nairobi and one in Nakuru. These are characterized by high population density, very crowded, typically high rates of violence, both physical and sexual. These are often sort of base for a lot of crime and gangs, as well as very active drug trade taking place in these neighborhoods, and a real lack of formal employment opportunities, which was very much an issue for the older adolescents participating in the program. So as I mentioned, we set out to see not only both to look at the impact of the program on girls and on boys, but also to look at and really test that hypothesis that outcomes for girls would be better if boys in the same communities were also engaged and receiving a similar type content. So we had one area where both girls and boys were participating in the program, another community where only girls were participating in the program, and then a third area which we used as our comparison group in this study. So just to give you a sense of when this program took place, so we actually started with the whole year of formative research where we did a lot of qualitative work, starting with girls to really understand who do they see as the influential males in their lives. When we started out, we weren't even sure that that it would be boys who were the target of the intervention, but we sort of listened to girls to understand who they felt like they engaged with the most and whose behavior change would really shift their lives. And that's where we landed on 10 to 19-year-old boys and young men. From there, we sort of designed the research. The intervention ran for about 1.5 years. And we did the baseline data collection, implemented the program. Along the day, we did qualitative data collection, looking at the perceived impacts of the program, and then wrapped up with the endline data. We were very lucky. We sort of closed it off actually just in very early 2020, right before the pandemic hit and shut things down. I just wanted to highlight a couple of points from our baseline findings that I thought were interesting. So, and one is that when we looked across our indicators, and in our study, we looked at not only gender norms and experience and perpetuation of violence, which are main outcomes that we were looking to shift, but we also looked at sexual and reproductive health knowledge, we looked at sexual behavior, we looked at economic behavior, financial literacy, etc. And what we saw was that girls and boys were much more similar to one another when they were 10 to 14, but that there was really this very sharp divergence. And I think that reinforces the point that Rebecca made earlier on, that this is really early adolescence is a period in which a lot of gender norms are cemented, and it's almost this last opportunity before the life course for girls and boys quite sharply start to diverge. We also saw that girls and boys were having similar levels of sexual activity, but the context was very different for girls and boys. Girls often talked about it in a forced context, an unwanted context, which was less so what we were hearing from boys. And also that violence was very common both for girls and for boys, but the nature was different, with boys experiencing a lot more physical violence, a lot more violence amongst their peers, whereas girls experienced more sexual violence, often at the hands of sort of relatives, neighbors, partners, and strangers. So highlighting a few points. So for today, the focus of the webinar, I'm going to focus in on our data really related to gender norms and gender-based violence. So from coming out from the qualitative data, there were some reported changes in thoughts and perceptions related to gender norms. Commonly used expressions such as boys and girls are equal and boys and girls can perform the same tasks. And also sort of relationships that were reported to be based on respect and mutual support. So girls and boys supporting one another and noting that that had shifted once they had been participating in the program. However, sort of further examination of another sort of key theme that came out, which was almost not necessarily contradictory, but are we changing perceived value of girls? Or is it really shifting the norm around sort of the expectations around behavior and task and ability? And this quote, I'll just read it out loud, was a 17-year-old boy who mentioned, in the family relationship, we used to look down upon girls. We thought that there was nothing that they could help us with, but we were taught that mothers and girls play a very big role in the community because they do so much. Even the man brings money for food. The women play a lot in preparing the food and so many other things which cannot happen without her. So here it's reflecting on sort of appreciating the role of women and girls, appreciating what they do and seeing value in domestic work, but not necessarily challenging those very sort of gender stereotypical norms. So then looking at sort of just high-level findings from our endline data, we used the measuring gender norms, we used the sort of validated measures that were in line with what our other colleagues and sites of the Global Early Adolescent Study were using. But just, to summarize, and the key takeaway was really that we did not see any difference amongst our three arms, sort of between those that were receiving the program or not receiving the program on any dimensions of gender norms. And we did sort of an overall analysis, but then we also did some matching within our sample to try to account for maybe sort of differences in who was participating in the sessions. But even after we did that matching within the analysis, we really didn't see any impact on shifting various dimensions of gender norms. So just to wrap up, why do we think that was? Some key takeaways. First, I'll talk a little bit about related to maybe the challenges that we're faced with the program that are sort of these key takeaways or lessons that we learned that perhaps could be adjusted in future programs that might link to stronger results or more positive results vis-a-vis gender norms, is that we struggled with participation. We had quite variable participation across the board, but also in particular some of the older adolescents, but also those that were out of school, both males and females, and trying to really, there was a needing to balance sort of their financial responsibilities, their need to bring in money versus their perceived sort of the value they attached the information that they were getting in the program. They faced a lot of competing responsibilities. We experimented quite a bit with alternative meeting formats. However, that just it seemed to work, meeting less frequently, but that meant that the exposure to the content was limited over the course of the year. Another thing we struggled with a bit was around mentor quality and attitudes. And I'd say this was particularly challenging vis-a-vis the gender norms component, and even more so amongst the male mentors. So sharing the information and the content around sexual and reproductive health, around entrepreneurship, around financial literacy, went quite well. However, when it came to sort of challenging what was the behavior that's expected amongst girls and boys, and this was in particular for men around really challenging power dynamics, giving the message of like needing to give up some like the power that men and boys typically have in relationships with girls. You know, first the mentors had to internalize that message, and the program really struggled with recruiting a sufficient number of young men or men in their 20s and 30s that were sort of on board with that and really well equipped to deliver that message. And that in retrospect, we probably needed to spend a lot longer preparing the mentors or preparing those that were going to deliver the content before moving into the program. And then thinking just also about the intervention design, I think one thing that the intervention lacked was a multi-level approach. And we saw this in the DRC example. I think they did a much better job about ensuring that the messages around gender norms were being reinforced at school, in the home, at the community level. And also finally, just reflecting on the duration and the content of the program. So was the intervention period long enough? I think in terms of really shifting norms, there has to be enough time to iterate between hearing the messages, acting on them, reflecting on them, and that sort of iterative cycle, practicing with sort of bringing the girls and boys together. And perhaps we didn't have enough time, but at the same time, like getting the time of these adolescents to participate in the program was challenging. So, you know, probably more work to do to find that sweet spot. And then finally, sort of, as I mentioned, this intervention wasn't solely focused on gender norms. That was one component of it. And part of that is because we believe quite strongly that adolescents, you know, they have a multitude of issues. And if they're taking the time to come to a program, they need information on economic strengthening. They need information on sexual and reproductive health and all of that. But did that then take away from the content or the exposure amount to the sort of gender norms component of the curriculum? And maybe we need to sort of think about how we balance that with the needs for other content and other types of interventions. So thank you so much for sharing. I'm happy if you have any questions to answer later via the Q&A, you can follow up or look at some of the materials from the program here. And with that, I'm going to pass it on to my colleague who will present the Indonesia case study.
Good evening from Indonesia, good afternoon and good morning. I'm Amala Rahma, I'm the country representative of Rutgers Indonesia. I would like to share the comprehensive sexuality education lesson learned from Indonesia, specifically under the program of Explore for Actions, where the setara in English means equal, and also the abbreviations of teens aspirations has been applied. I want to start with the testimonial video from student and teacher who were exposed by the Setara program. The video is just 4 minutes and the subtitle in English.
Setara, semangat dunia remaja, adalah modul pendidikan seksualitas komprehensif yang diperuntukkan bagi remaja usia 12 sampai dengan 15 tahun yang duduk di SMP kelas 7 dan kelas 8. Setara bertujuan untuk mendukung remaja bertumbuh menjadi sosok yang sehat dan positif dan bisa membangun hubungan yang dilandasi rasa penghargaan dan tanggung jawab terhadap diri sendiri dan orang lain. Untuk itu, Setara diperlengkapi dengan materi untuk membekali orang muda dengan pengetahuan, sikap, dan keterampilan untuk memahami diri sendiri dalam masa pertumbuhan dan pubertas, perubahan sosial emosional, citra diri positif, dan berelasi dengan orang lain. Sejak tahun 2011 sampai dengan 2020, Rutgers Indonesia melalui beberapa programnya telah mengimplementasikan modul setara di 104 SMP di 8 provinsi, yaitu di Sumatera Utara, Lampung, DKI Jakarta, Jawa Barat, Jawa Tengah, Jawa Timur, Bali, dan Lombok. Modul setara terdiri dari 25 topik untuk kelas 7 dan 20 topik untuk kelas 8. Pengajaran modul setara dipimpin oleh guru dan dilaksanakan dalam periode 2 tahun. Sekitar 56.000 siswa kelas 7 dan 8 telah menerima manfaat dari pembelajaran setara.
Perkenalkan, nama saya Rizal Abista Pratama.
Halo, perkenalkan nama saya Nabila Rizky Amalia.
Halo, nama saya Elvi.
Perkenalkan, nama saya Rama Jamil Sitotuhu.
Perkenalkan, nama saya Safira Dia Andari.
Halo, perkenalkan nama saya Zaskia Messi Azalia.
Perkenalkan, nama saya Estrelia Kristiana, saya dari SMP Negeri 22 Semarang.
Dari setara, saya belajar mengenai organ reproduksi dan bagaimana cara merawat diri. Misalnya, mengganti pakaian dalam dan mandi 2 kali sehari.
Dengan belajar setara, saya menjadi lebih memahami perbedaan ciri fisik laki-laki dan perempuan dan perubahan yang dialami saat pubertas.
Dengan mempelajari setara, saya jadi lebih memahami diri saya dan perubahan yang saya alami baik secara fisik maupun emosional.
Dengan belajar setara, saya jadi lebih tahu bagaimana cara menghargai orang lain dan diri saya sendiri.
Setelah saya belajar setara, saya jadi tahu bahwa hubungan sehat itu tidak mengandung kekerasan dan saling mendukung satu sama lain.
Pelajaran yang saya dapat dari setara membuat saya lebih dekat dengan kedua orang tua saya. Karena saya dapat bercerita apapun tentang keseharian saya dan mendiskusikan hal-hal yang dianggap tabu.
Dengan mempelajari setara, saya mulai belajar untuk mengatakan tidak terhadap perlakuan dan permintaan yang membuat saya tidak nyaman. Saya juga belajar untuk mengurangi rasa insecure, serta belajar untuk menerima diri sendiri dan juga mencintai diri saya sendiri.
Pembelajaran dengan modul setara ini membuat siswa lebih tertarik dan antusias, dan banyak sekali siswa yang bertanya, mengutarakan pendapatnya tentang materi yang disampaikan. Membuat siswa menjadi lebih berani untuk mengemukakan pendapat ataupun mencari tahu hal yang ingin mereka tanyakan kepada kami.
Menurut saya pribadi, dengan adanya setara di sekolah kita, saya merasakan pengalaman bahwa anak-anak itu memang mengalami perubahan. Yang darinya dulu di kelas 7, memang dia belum mendapatkan modul setara. Setelah di kelas 8, kebetulan saya yang mengampu sendiri, mereka menjadi lebih memahami apa itu tentang pubertas, tentang berpacaran. Mereka lebih enjoy, lebih bisa menerima dirinya.
Mengajar setara menjadikan saya lebih kaya dari sisi keterampilan mengajar karena saya bisa menyampaikan materi lebih menyenangkan dan bervariasi bagi anak-anak.
So everyone, setara is 2 years CSE comprehensive sexuality education intervention for standard 7 and 8 junior high school, which is 12 and 15 years old. The module itself follows the UNESCO International Technical on Sex Education and adapted from WordStar With Me module. And to support the program implementation during 2018 to 2023, a partnership between Rutgers Netherlands, Rutgers Indonesia, University of Gajah Mada, Johns Hopkins University, Karolinska Institute, and PKBI studied and evaluated the setara in 3 locations in a city level, in Denpasar, Semarang, and Bandar Lampung. Some key findings of setara impact we found during the evaluation. We found that students receiving setara demonstrated a significant increase in competencies compared to control student, which include first, the knowledge about pregnancy. This is very important, and self-efficacy to prevent pregnancy. And more gender equal attitude, like, for example, the roles between boys and girls. And they also have a positive dream about the future and more communication about sexual and reproductive health, as also been mentioned in the video. They have a good communication with the parents. And it is also found a greater effect on girls, such as they understand about menstruation, about bodily anatomy, and also they can say no for something that treat them in a school and also in a community level. And from the 3 different locations, we found that Semarang city has the greatest effect compared to the 2 locations. And we learned that the dose of the comprehensive sexuality education session is matter. It is like a linear. The highest the dose delivered to the student, and the highest quality had the best result. And the dose were influenced by in Indonesia since especially in the last 2 years, the dose were influenced by COVID situation that made school closure, especially in these 3 cities, and that makes teacher have to prioritize the subject at school, and it's become like a competition in what's compared to other subject in school. And also how blended the session with the existing curriculum, or how the local government support for the setara in terms of not only for the budget, but also for the regulation at school level. And while in internal aspect, especially for the module itself, the session we feel the session that too long for lesson hours. Some of the sessions were designed more focusing on girls empowerment, and we feel it's not enough for boys. And teacher skill, in terms of teacher skill, is very important, as they are the only one who has authority in the classroom. So in terms of the teaching of learning, we really depend on the teacher skills, starting from the lesson plan and also the way they deliver and how they develop or they choose the learning media for a student. And the last one, teacher value misaligned with setara curriculum, and in some area create a fear of a backlash, especially from male colleague. That is why the value exploration and value clarification for teachers should be done along the program implementation. And starting from 2021, for the new project, setara program required value exploration and value clarification for teachers before it is implemented or delivered to students. Some lesson learned and recommendation for the next comprehensive sexuality education, we see that the quality and doses matter, and we need to work with teacher training colleagues, because in Indonesia, for the junior high school at public school, there are around 10 million students with only 700,000 teachers. So we can imagine how many budget have to be allocated if we work in the area of downstream. So we have to work in the upstream area together with the training institute who produce teachers. And digitalization of curriculum may provide a partial solution for overcoming persistent implementation, especially in terms of the COVID situation and also for the urban area. And also it solves the cost barriers. But using blended approach, it's still important to maximize working mechanism. So the combination between digitalization and offline meeting is also have to be considered in delivering the comprehensive sexuality education. We have to improve relevancy using pedagogy approach and benefit for CSE for boys. This is still a challenge in terms of Indonesia setting, where reproductive health usually associated only for girls and women. So this is This is how we have to mentor and coaching teachers along the program. And research process useful to strengthen stakeholder engagement and collaboration. We found that having a research result providing us in a very natural discussions with the stakeholders, especially for the government and the opposition. And we use that as one of the approach to convince them that the comprehensive sexuality education is important to be invested in a certain area. And the last one, don't forget and don't leave and engage young people as co-researchers, because we really find this strengthen and enrich the program recommendation. Thank you, and I will over to my colleague, Christine.
So as Rebecca said, I'm going to just shut this off really quick. Early on, there was, Rebecca mentioned we did an intervention working group among all of us in the Global Early Adolescent Study, or who were at least affiliated with the Global Early Adolescent Study, to form a overarching theory of change. Is there a way that we can make sense of how these gender transformative interventions working together are influencing outcomes? And so this is a depiction. I know that nobody can see this, but you can get a sense that this is a vertical depiction of how we're looking at our theory of change. So I'm going to start just breaking this down a little bit here. And if you see this first part, this is the top part of the theory of change. And it shows you what the long-term and short-term outcomes of the programs that are targeting. And at the top part, you can see there are the 5 different interventions that we see. And so you've heard from 3 of them. The ones that you haven't are CRAFT, and that was a trauma-informed gender-based intervention that was implemented in New Orleans. And then there was the Very Young Adolescents 2.0, and that was implemented by colleagues from Permundo in Blantyre. So again, each of these all are targeting gender in different ways and are all focused on very young adolescents. And you can see here that the bulk of the outcomes that are being focused on are in the sexual and reproductive health rate, followed by violence. And then if we look at the short-term outcomes, I'm not going to go through this in any great detail, but just to point out a few key things of where we're showing where these commonalities are. You can see that in the behavioral short-term outcomes, most are also targeting improved health seeking, and interpersonal. They're also focused on improved communication, as well as improved conflict resolution and negotiation. And then at the individual level, you can see that there's a number that are focused on these individual level knowledge, comfort with emergent sexuality, critical consciousness. So
Kristen, I'm sorry. Can I interrupt you for 1 second?
Yeah.
You don't have your slides on presentation mode, and it's a bit hard to see.
Ah, thank you for
because it's so small. So if you could make it bigger,
yes,
I think that would help us all. Sorry to interrupt.
Thank you so much. Okay, so maybe this you can all see this in a little bit more clearer, but we'll try to get you access to all these slides as well. So moving on then from the outcomes, this is the middle part of our theory of change. And you can see here that this includes the activities at the bottom and the mechanisms of change. And there are 3 columns that we divided these interventions into components. So the first one, the green one, is the delivery component. That's when we're talking about the facilitation of the intervention. Then we go to the middle column, the red column, that's the content or the curriculum materials. And then the last column is what we're calling the supportive environment. And these are the partnerships and the stakeholders that we need to create a supportive environment to implement the intervention. And again, not to go through all of these things in detail, but to just point out a few things that in each of these columns, you can see that the key mechanisms of change are things like promoting positive norms, strengthening practice and practicing skills. In terms of activities, the facilitators, most of the interventions had an initial training. They included supportive supervision. Another key thing is that they also had a values clarification in terms of what was being taught and what the facilitators' values were. In terms of content, there were both reflective and small group discussions, educational sessions, and then the interventions tried to have parent engagement. They tried to look at different systems, especially you could see in Growing Up Great, there was a healthcare and community integration, and then community sensitization. But it's really when we get to this slide here, and this is the bottom of our theory of change. And this is what we call the conditions for success. And this is basically what we call the foundation of our theory of change, because these are the factors that we identified from the implementation data as being critical for successful implementation. And we specifically labeled them here because if these are not in place, the activities are not going to be implemented well, the mechanisms of change are not going to be operated on, and we won't see the changes in outcomes that we're expecting. So again, not to go through each of these in detail, but you can see here that in the facilitation column, if facilitators have experience working with youth, if they have equitable gender attitudes, that is going to lead to more success. In terms of curriculum, if there's engaging, if the curriculum allows for engagement with boys and girls, if it's developmentally appropriate, those are the things, again, that are going to contribute to success. And then finally, if we look at the partnership column, if there's multi-sectoral support, if we have community champions, such as parent groups or organizations in the community that can help facilitate support, that again is going to lead towards more success. And so at the very bottom then are just what we consider are the key principles and approaches that we use to design and also implement each of these interventions. So we think that this last part, though, is the key contribution to this theory of change. So many theories of change just focus on activities and how they lead to outcomes. But what we really learned through our interventions and our the studies that we just went over is that we really need to understand more about the implementation as well. So now to just take a step back of all that we've heard, I want to just point out a few key messages before we turn to Grady, who's going to be our youth perspective speaker. So first of all, one of the things that we didn't really go into detail, but something that we found, especially with the longitudinal data, is that the intervention effects on normative gender perceptions, so attitudes and beliefs about gender, really differed by program. In Growing Up Great, we saw that most of the change with adolescents in terms of gender was focused on household chores. And this was because that was how the program was very concentrated on. It was the big focus. Whereas at Terra, we saw more changes in broader gender norms. And there was a review that recently came out that sort of explains this. And this found that in gender transformative interventions, the more accessible the message is to the adolescents and the more engaged a person is with the messaging, the stronger that attitude is formed. So again, this may reflect the fact that in some of these programs, adolescents may not have found the message to be accessible to them. So something to think about again. The other thing that we found is that, interesting, girls are benefiting the most from these interventions. We asked this question to our Global Youth Advisory Board when we had a summit with them this summer. And it was interesting what the response was. And most of them said, well, of course, because when we think about sexual and reproductive health interventions, that's typically seen as a girl issue, not a boy. So boys tend to just not identify with that as much. And so that could be one factor with this. But another factor, again, related to this review of gender transformative interventions that came out, is that they also found that boys and girls are learning about things differently, and we need to respond differently to their learning approaches. And the study specifically found that girls may be responding better to education-based interventions. So most of what these interventions were based on, whereas boys respond better when it comes to more community mobilization and peer support. So again, thinking about how those different approaches may also impact whether boys and girls are seeing intervention effects. We also spent a lot of time in our intervention group going over the implementation challenges that were all being faced. And that is why I drew attention to the last slide on our theory of change about the conditions for success, because too often we often think about, well, does this intervention work or not? And we don't pay enough attention to the implementation challenges that are often faced, like how do these things get implemented well? And so as we go forward, we really need to think about not just whether an intervention works, but how well was it implemented and how can we learn from each other to make sure that implementation is done in a more successful way. And a lot of it we can't control, but I think as we more and more share with each other, then we can learn some of these lessons. And then finally, the last thing that I want to point out is that interventions are still primarily focused at changing adolescent attitudes and behaviors. But what we know is that, especially when it comes to gender norms, there are key socialization agents that we call, such as parents and teachers, that are delivering sometimes contradictory messages to adolescents. And so unless we also start integrating them into our design, as well as our implementation and evaluation to see if there are changes among their attitudes and behaviors, we're not really going to be expecting to see a whole lot of gender norm change. And so we are calling on for more interventions to think about ways of including these other change agents. So those are the main messages that I want to bring up right now. And with that, I am going to stop sharing my screen. And I'm going to allow Grady, who again has been one of our key Global Youth Advisory Board members, to offer his youth perspective on what he has heard today. So Grady, why don't you take it away?
So I'm greeting you at first, so hope that you're fine. So am I really supposed to, to use the video, or it's better like that?
Feel free to do whatever feels best to you. If you can use your video, that would be great, but do whatever's most comfortable.
Okay, here we are. So I'm greeting you all. So I'm really fine. So I'm about sharing my experience during the growing up grade project. So it's been a while that I've been in the project, and today I'll be sharing my point of view. So Christine shared something really important. So saying first, the end of the slide. The end of the slide was really important concerning interventions still primarily focused on adolescents. That was really the right key that we found out in the growing up grade project. After all, we did evaluation. So according to what many person has been presenting. So, and then especially us, adolescent of the growing up grade, we did a lot of things. So we were sharing many things, many subjects, according to sexual reproduction health and so on. That was really great and interesting to see how beautiful and even how better and how strange that could be feel, and how boys can be told to girl about sexual reproduction health. Because at the beginning that was really tough to do. That was really tough to do, and some of boys were really shy talking to girl about sexual reproduction health. But after times and times, so we've developed ourselves in growing up great project, as I've been saying, and then that became a really great experience. And after all, we did I must say an evaluation, the participating evaluation that we've been doing. That was really good and a great experience that we did too. So it was about to know what changements adolescents have been seeing since that they joined the project, and we did that evaluation. We were evaluator talking to boys, talking to adolescents, talking to parents, and talking to teachers too. We evaluated them, and we took changement that they saw from the growing up grade project, starting from just at the beginning, because we need to know what changed into them, goodly and badly. That was the main subject of the evaluation, and that's what we did, and it was really great, and I'm really happy to to share that experience with you. And hope that you'll be liking it. So I'm really happy. I'm my stepmother. If you do have any question, I'm here to respond. Thank you.
Grady, thank you so much. It's so fun to see you there. So now we're going to turn it to you, the audience, and a chance for you to ask questions. And we'll do it a number of different ways. So there are some of you that have already typed your questions in the Q&A, so we can try to get through those. But then also you can feel free to try to raise your hand, unmute yourself, and we can try to hear you if you'd like to speak. But let's try with the Q&A some of the questions that have already been written to make sure that we address those first. So I'll start off with Marjorie, and she is asking, how are LGBTQ issues being addressed in more conservative communities? So one of the ways that maybe we can turn it to Amala, because there are some differences in Indonesia, or even Miranda, one of you two can address that, because in Indonesia was a great way to think about how the different settings can impact on intervention success. And so there is a difference in the conservativeness across the three sites. So I don't know, Amala, do you want to address that?
Yes, Kristen. We actually, until now, even though the Ministry of National Education and Ministry of Health supported the reproductive health education, even we don't use comprehensive sexuality education in here, we use the term of reproductive health education, which more acceptable by the government at national and local level. We don't really open in discussing about the sexual orientations. So we usually try to understand the different problem faced by the local government. So we enter from that problem to provide solutions. So so far there is no local government that provide talking about this sexual orientation as a problem in their area. And that is why we don't really open to talk about that at the school setting, but in a different module that reach for the community and also for the groups of LGBT, we have a different module that is more open to discuss about the GEAS.
Thank you, Amala. And I just want to add that one of the things we did learn with the implementation research study that was done in Indonesia is that it also makes a big difference in terms of how you introduce the intervention to a community. And so we found that there were some challenges with this depending on who you go to first. And so getting that acceptability and support, whatever the topics are, is a really important thing that often doesn't get discussed, but we found out how important it was, especially in Indonesia.
Yeah, it's like in Lombok, we discuss about child marriage. And also in a different area, we talk about different reproductive health issue. So we start from that problem to provide the solution based on the reproductive health education. So it's not one solution to all area in Indonesia. That is why it is more acceptable, because we, together with the local government, trying to provide, to improve the performance actually. It's not we come to the local government and then saying that your problem is this one and this one, but rather than we try to embrace them with their problem that they are facing at that implementations, during the implementations program.
Mm-hmm. Great, thank you, Amala. I'm going to turn it now to May, and Rebecca, I think you're going to answer this question, but I want to just phrase it for the group is, what do you do for parents not to misperceive you for changing their children's norms and values? So Rebecca, do you want to answer that?
I actually flagged it for other panelists to answer.
Oh, okay.
Might be, yeah, I thought it was a great question, but it would be better for our panelists to answer.
Gotcha. So who would like to take a stab at that? Blendine, would you like to? Or Karen?
Moi, je peux commencer. Ça me fait un peu rire parce que j'ai eu ces différentes réactions quand il fallait former même déjà les enseignants, parce que là, je prends les enseignants, mais ils sont aussi parents. D'autre part, quand vous arrivez dans une séance, dans une salle de formation, ils sont là et vous annoncez le thème de la formation, que nous allons vous former sur la santé sexuelle et reproductive des adolescents, que nous allons mettre des clubs au niveau des écoles qui vont aborder les questions sur la santé sexuelle et reproductive. Alors, quand tout le monde entend sexuel, ce sont des regards qui sont vraiment rivés sur toi. Tout le monde te regarde comme ça, ils ouvrent les yeux. Ils disent, mais qu'est-ce que cette docteur Blandine va encore apporter à la vie de nos enfants, à notre culture? C'est quoi encore cette histoire de santé sexuelle et reproductive? Qu'est-ce qu'on veut apprendre à nos enfants? Et entre guillemets, ils vous disent, vous voulez apporter ces histoires de blanc à nos enfants. Nous avons notre culture, nous avons nos croyances. Vous ne pouvez pas venir et parler de santé sexuelle, de ces choses-là avec nos enfants. Alors, on avait un exercice qu'on faisait souvent au début de chaque formation. C'était le gap entre le service et le besoin sur la santé sexuelle et reproductive. Cet exercice était vraiment très capital pour pouvoir vraiment faire tomber les barrières. On faisait cet exercice-là, on faisait maintenant voir aux parents qui étaient présents, même dans les sessions de formation en tant qu'enseignants, même dans les sessions de vidéos, le besoin par rapport aux adolescents sur la santé sexuelle et reproductive se développe à partir de quel âge? Alors, il y avait des questions, on les amenait à réfléchir et les services qui étaient disponibles par rapport à cela. Et puis maintenant, on définissait qu'est-ce qu'on appelait santé sexuelle et reproductive, c'est quoi le contenu de message qui sera développé pour vos enfants au niveau des écoles et aussi au niveau des sessions extrascolaires et tout. Alors, on leur faisait voir, c'était les différents changements sur lesquels les enfants passent. Est-ce que vous-même, quand vous étiez jeune, vous n'avez pas eu ce changement, vous n'avez pas eu ce problème? Qui vous a aidé? Qui vous a accompagné? Alors, ils se remettaient un peu en question. Alors, ils comprenaient maintenant l'importance même d'aborder ces différents sujets et qu'au fait, ce sont des choses du vécu sur lesquelles eux-mêmes ils sont passés, mais ils n'ont pas eu quelqu'un pour les accompagner et que les enfants aussi passent aussi par là et que si aujourd'hui, ils sont formés, les enseignants sont formés, ils pourront peut-être maintenant bien accompagner leurs enfants pour que les enfants maintenant puissent bien passer cette période de puberté et avoir les bonnes informations et auprès de bonnes personnes. Donc, je crois que les débuts de chaque intervention, comment est-ce que nous présentons l'intervention, le public, les cibles, les acteurs clés auprès desquels nous expliquons, nous présentons ce que nous voulons faire est très, 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 très important. Et ça ouvre la compréhension, ça ouvre l'intelligence même de ceux pour qui, hier, avant de comprendre, d'avoir toutes ces explications, ils se faisaient beaucoup d'idées. Alors, quand ils comprennent que ce sont que des choses normales, physiologiques et qui créent un besoin par rapport à leurs adolescents et qui doivent les accompagner, alors ils deviennent maintenant plus ouverts et ils viennent même vers vous, vous dire merci docteur, maintenant nous accompagnons nos enfants, maintenant nous formons nos enfants et c'est comme ça que nous avons pu bien mettre en œuvre ces activités-là sur le terrain, que ce soit avec les enseignants au niveau des écoles, que ce soit avec le prestataire même au niveau des structures sanitaires et aussi avec certains membres de la communauté. Merci.
Thank you so much, Blandine. Let's turn it over to Victoria. And we can have even Karen or Rebecca if you want. The question is geared towards Rebecca, but let me just phrase it. There's interest now to start engaging boys and girls earlier during their pre-adolescent age. Has there been any efforts through this work? And then specifically, Rebecca, on what age do you think fits best for this pre-adolescent age? Is it 6 to 9? Is it 8 to 9? Any reflections?
Yeah, I can take a shot at that one. So I think from early on when we started working in this early adolescent work, maybe 10 years ago, there was some pushback and people were starting to say, well, why so late? You know, why not toddlers? Why not, you know, younger kids? And I think for myself and my colleagues, it was really sort of a question of, you know, logistics and who our colleagues were and where we had space to work, which were in community, schools, and families. But I think that's changing now with this really exciting global focus on ending violence against children and improving parenting. So I think there is a lot of work now going on around the world with parents and communities working with younger children, like toddlers. But I think the reality is that you need these interventions at every stage of the life course, starting as early as possible. And depending on where your discipline is and where your kind of arena of work is, your area of practices is where you can work. So, if you work in education, if you work in early childhood development, I came to this work from sexual and reproductive health. So even moving down to early adolescence was a bit of a stretch. And it took a lot of work to get people to see why we were working with kids who are not yet sexually active. I'm sure others have reflections on that topic. It's a really good question.
Yeah, thank you. I'm going to just ask our panelists if anybody has anything to add to what Rebecca said.
Sure. I'll just add, I agree with what Rebecca was saying. And I know at Population Council, we are starting to think through intervention designs for addressing gender norms, even within early childhood development programs. I think it changes the dynamic of the program. It's almost a parent's right? Like even very young adolescents, it's maybe the earliest age in which you can run a program that's not also directly simultaneously engaging parents. So thinking about how to couple interventions for parents and at the ECD level, programs for adolescent mothers and their children that would also incorporate a gender norms component. So I think it is one of the next sort of frontiers, so to speak. I don't really like that word, but areas to really explore more in depth. Thanks.
Yeah, I think that's a good thing to think about. And in terms of, my mind always goes to measurement. So even if we go there, how do we know it's working? We're going to have to measure this. And so are there tools available right now for measuring gender norms among that age? So anyways, yeah, interesting discussion. Anybody else like to comment on that before we move on? Okay. So we have another question about, do we have any idea about why boys are more responsive when the community-based interventions are incorporated? Again, this was from a review. They didn't have really explanations. They just are reporting what they saw. But we do have a youth member among us, and Grady, I don't know if you have any thoughts about this, about kind of the differences, maybe just a comment on, do you think that boys and girls learn differently from interventions? Do you think that they should, are boys more, why may boys be more better suited for community-based interventions, if that's actually true or not? We're not sure. This is just from a review. But Grady, do you have any thoughts on this?
So I might only say that it is according to what people think in their mind. We can also say that mostly boys showing up, if I can say so, like being first, being strong, and that's what pushes girls behind. And up to me, there aren't any difference between boys and girls according to that. Yeah, but mostly, sometimes boys prefer being the first, prefer being the host instead of living girls doing such things and so on. Yeah, that's it.
Thank you, Grady, so much. Anybody else have any thoughts about that? I think it's definitely an area to think about and to do more research on, if that's actually true or not. So yeah, thank you so much, Grady. We're running a little bit short of time, so I want to get a question that maybe perhaps all of our panelists can think about, and that is from Aditi, is about how will the gains of the interventions be sustained after projects come to an end? So the big sustainability question. So perhaps I can turn it, Amala, do you want to go first and think about that?
Yeah, Thank you. I think since the beginning, you have to engage the governments because they are more sustainable rather than project by project. So since the beginning, you have to work together with them to co-planning and then together with them implementing and also engage them in the evaluation and monitoring. So there is the ownership grows since the beginning of the program. And the second one is you have to really match the budget with the local government, because the more expensive the program, the more less government will buy in the program itself. And the third one is we have to make sure that you learn about the key performance indicators of the government level, so you match that with the program. It's in Indonesia, in some area, some government already take the buy-in the government and take responsibilities from the Setara program into their local budget. And at national level, they also already have an MOU together with the Ministry of Health and Ministry of Education and Rutgers Indonesia and UNFPA as an implementer to make sure the quality of the program, while the government will focus on the quantity and take a massive actions across Indonesia in terms of policy.
Great, thank you, Amala, so much. How about Blandine? Any thoughts about sustainability? I know that things are already happening in Kinshasa around this, so do you want to share that?
Oui, Christine, par rapport à la pérennisation, nous avons beaucoup plus travaillé sur l'implication déjà dès le départ des différentes parties prenantes. Donc là, nous voyons le ministère de la Santé, le ministère de l'Éducation. Avec le ministère de la Santé, comme nous avons travaillé pendant tous les processus, révision des outils, contextualisation, suivi et tout, aujourd'hui, ils ont intégré dans leur plan stratégique les différentes visites que nous avons eu à mettre en place par rapport à ce programme bien grandir, de sorte que ça puisse continuer entre les formations sanitaires et les différentes écoles où les activités de santé sexuelle et reproductive sont menées. Avec les clubs, donc c'est maintenant dans leur plan stratégique. Au niveau du ministère de l'Éducation, nous avons travaillé à faire agréer les outils que nous appelons souvent les outils beige et les outils bien grandis, dans les différents outils que nous avons à utiliser dans les clubs scolaires. Aujourd'hui, ils ont été agréés au niveau du ministère de l'Éducation comme faisant partie du paquet de formation des enseignants à tous les niveaux sur le curriculum national d'éducation à la vie familiale. Donc, ils accompagnent maintenant le curriculum national. Ça, c'est déjà un acquis. Et aussi, au niveau communautaire, par rapport à l'animation des sessions, au début, nous avons commencé avec les membres des organisations de la société civile, mais après, nous avons passé la main aux membres de la communauté, ce qu'on appelle souvent les relais communautaires, qui jouent le pont entre les structures sanitaires et la communauté. Nous avons formé à animer ces sessions et aujourd'hui, ils ont intégré ça dans leur paquet d'activités, donc ils vont continuer à animer ces sessions avec les différentes vidéos que nous avons développées au niveau de leur zone de santé et aussi avec les adolescents eux-mêmes. Comme Grady lui-même l'a dit, il est aujourd'hui le président du conseil de jeunes qu'on a mis en place parce que c'était d'abord des bénéficiaires. Ils ont accompagné, on les a accompagnés. Aujourd'hui, ils sont une association sans but lucratif dans le but d'accompagner d'autres jeunes, d'autres pères pour pouvoir donner aussi, faire bénéficier à d'autres l'expérience qu'ils ont eu à vivre, à capitaliser avec bien grandir. Donc, on va continuer à travailler avec eux, nous-mêmes en tant qu'organisation, et même aussi de leur côté, ils vont aussi continuer aussi à mobiliser des fonds pour pouvoir continuer à être des modèles et des encadreurs pour les très jeunes adolescents au niveau de la communauté et pourquoi pas pour toute la RDC. Merci.
Wonderful. Thank you, Blandine. So we can see some commonalities of making sure that all levels are being focused on for the sustainability of such interventions. Karen, I'm wondering, is there anything that you can also share with us about Nisitu and what's going on with that?
Sure. I think our objectives with NEC2 was maybe slightly different in that we weren't necessarily trying to, from the get-go, set up a program that would run in perpetuity, but really test this one particular question. But maybe a different angle on the sustainability is really thinking about the resources that were developed and the community partners that we worked with, that we continue to work with on different, supporting them in different iterations of empowerment and asset building programs for adolescents, and really so we have taken pieces and retained pieces of the curriculum that was developed for NEC2, the notion of sort of retaining the sex segregated groups, but with some opportunities for joint conversations with that, which the adolescents sort of reported that they liked. So really not necessarily continuing NEC2 itself, but picking the successful pieces of the program and integrating it into ongoing work of other partners in this area. Thanks.
Thank you so much, Karen. And I'm just looking at the time, and I'm gonna just say that I think we are going to end our Q&A right now. I want to thank you all for joining. Despite all the time zones, I think this was a wonderful way to discuss how we can better serve very young adolescents with these gender-based gender transformative interventions. I want to thank especially our panelists. Thank you so much for sharing your slides. And if anybody would like to have further information, please feel free to contact us. We have that information available, I believe, on the flyers, but you can go to our website. Trevor, is there anything else I should share with our group? Otherwise, I want to thank you all for this great conversation.